Hey everyone, welcome back to Reimagined with Robin. Happy New Year. Thank you for making us a part of your day. It is actually really nice here and not too cold on the East Coast, but I hope that you'll all have a joyous sunshine to your day with this show. Just to kind of go back, Reimagined with Robin is a 15-minute live conversation with a leader who is working to reinvent how we interact with the world that we live in, from lost and found to gifting and more. I really love the topic that we're going to talk about today to kick off 2023, because it's something that I believe every single person can relate to. And also, I'm really excited to start the year off with James. But before I do that, I'm going to turn to our audience today and want to ask you, when was the last time you called somebody, not text, just to say hi and catch up with them? For me, I think that was probably more than a month ago for an actual call. So, James, we're going to turn to you. You are our guest speaker today because you're actually going to talk about a topic of what I just said. But James, you are the CEO of Loop. I've actually gotten to know you way before Loop for over 5 years now, and you have been such an amazing friend, a mentor, a former colleague, and EIR at GGV too. And so really honored to have you here with us today.
Yeah, absolutely. It's been a joy also working with you and the whole GGV team. Such a good group of people.
Thank you. Well, we, as usual, will kick it off by asking the question of the show. What is it that you are reimagining, and what is that disruption?
Yeah, I mean, broadly speaking, I would say our healthcare system, and of course, I think every startup in the healthcare system says that. So let me define that a little more specifically. But I think when we think about preventative health, there's a lot of dialogue around it. There's a lot of reasons we need to invest more in preventative health, but I don't feel we're doing nearly enough. And there's still, the majority of our healthcare system today is still very focused on, severe downstream health issues, which makes sense in the sense of they're acute risks that we have to deal with. But they're also how the traditional health system monetizes, and preventative health is kind of playing catch up a little bit. And so when you think about preventative health in terms of where we sit in that category, I think there's been a lot of progress on things like nutrition or sleep, stress, but loneliness is this just giant issue that keeps getting worse, and I feel like we're very, very underserved and under-resourced in tackling it. And so that's the area we're hyper focused on, is how to address the loneliness epidemic.
I feel like loneliness is something that kind of rose to the forefront, especially after COVID and everything that's happened with the pandemic.
Yeah, I feel the awareness of it, and discussions around it, I think rose, but it certainly was not, it was only there and growing prior. And I think that speaks to some of the common misconceptions around loneliness, which I think, we'll get into in a second.
Yeah.
And we could just kind of jump in there. But the one point I wanted to draw on loneliness from a preventative health standpoint is that, we're social creatures by nature. So if you're experiencing prolonged loneliness, it has an adverse effect on every part of your health: depression, anxiety, cardiovascular illness, dementia. These are all things that loneliness contributes to. And so that's why, kind of we look at it as a big preventative health opportunity. But yeah, let's get into some of the misconceptions, because honestly, even for me, I had these misconceptions all my life. If you would have asked me 10 years ago when I was experiencing loneliness, I would have said no. And that gets to the kind of first misconception about loneliness, is that people conflate it with being physically alone. And the truth is, you can experience severe loneliness even being around people day to day. Being physically isolated can contribute to loneliness, but it's not a prerequisite for it. And I think the example that I often give around this for myself personally is loneliness I have felt in my career. And I have felt it at times when I was working for large companies in person, surrounded by people. And, for me, it stemmed from, I have struggled at times in my career to build strong, healthy relationships at work. And that often it started, I guess, for me, like dealing with critical feedback. I didn't always deal with that well, or battling with my own imposter syndrome, or a lack of social awareness and how, my behavior might be perceived by others different from my intentions. And these issues for me would create, make it hard for me to create strong, reliable connections with my colleagues. And the stress of feeling lonely at work will then negatively, in fact, impact on my job performance. So it's just vicious cycle that all stemmed from really issues related to social interaction, which made me feel lonely. Yet I was constantly surrounded by people, and often fantastic people who wanted to collaborate, wanted to support me, but I wasn't socially healthy enough to do so. And we'll talk in a second about social health and the concept. But I think that first common misconception is that being physically isolated is not a prerequisite for experiencing loneliness.
Yeah, I think that's a really good point, because I think all of us face this at some point, or have faced parts of what you said, right? Like whether it's imposter syndrome, or like not wanting to confront somebody, and like then you kind of start combating your own emotions because of it, and then you start isolating from a group. And I think that happens like at school, it happens at work, right? Like, and sometimes it even at home, like in your household, it can happen.
It can happen with neighbors. It can happen with strangers. You know what I mean? It happens in all phases of our social lives. Another misconception is the association between loneliness and being an introvert. A lot of times people think, well, introverts experience loneliness and extroverts don't. But being an introvert does not mean you are experiencing loneliness or are comfortable experiencing loneliness when we talk about it from like an epidemic and health issue. It simply means that, like, I think a simple way I think of introverts is you sort of charge your battery when you are alone, and you use your battery when you are with others or social, but you still need the latter. Extroverts are vice versa, but both introverts and extroverts can experience loneliness. Introverts, like myself, need strong, healthy relationships as well. So that's another common misconception. And I think a third one that kind of gets into our solution a little bit is this misconception that could solve loneliness by simply knowing more people, by joining a bunch of meetups or Twitch streams or church groups, and you won't feel lonely. But that's not really how it works. Like if you join a Twitch stream but don't have the social confidence to interact and build connections with people when you're doing so, you're not really solving for your loneliness. And if anything, you can exacerbate it, because here you are surrounded by people with common interests that you can't connect with them. And so it can actually make loneliness even a bigger problem for you.
Oh, yeah. I think that even at work, right? Like going to a networking event or something that you have to do with like a large group of people, or even going to like a school event for your child and like you're surrounded by other parents there. Like if you don't interact with anybody and you don't know how, then you're kind of, I think you're right. Like you're not solving the problem of loneliness just because you're just around other people.
Absolutely. And then we think about so that's, helping us like define the problem, right? And clarifying what we mean when we talk about loneliness. We think about the size of the opportunity, the size of the need here. There was a Harvard medical study in 2021 that found that 36% of US adults reported serious loneliness. And for young adults in that 18 to 25 range, it's a staggering 61%.
Wow.
So that's 1 in 3 adults, and over half of young adults are experiencing this. And that's a massive problem. And obviously that was 2021 coming out of the pandemic. The pandemic definitely made this problem worse. But I think you can make a pretty good argument that the loneliness epidemic is the biggest unmet problem in our healthcare industry. And I think definitely the biggest unmet problem when we think of the preventative healthcare industry.
I mean, those numbers are staggering.
I'll ask you, Robin, as an investor who sees a lot of deals, a lot of things come across your desk, right? GGV is a broad VC in a sense that invests in a lot of different areas. How many treatments or innovations have come to your desk that are specifically addressing loneliness versus other areas of preventative health like sleep, nutrition, stress? Like, can you think?
I mean, so much of it tends to be, it's solving for, a very specific problem that is like you need physical therapy, or you like it from like a health related standpoint, right? Like, or it is for weight loss, or it is, but I don't think I've really come across anything that is loneliness, just targeting loneliness itself. Yeah.
So I think when we think about solutions, and then we'll, this kind of gets into how we think about it here at Loop, is that we think of this concept of social health. And what I mean when I say social health, if physical health is a measure of the health of our body, and mental health is that of our mind and emotional state, social health is sort of like a measure of the health of our relationships in our life. Mm-hmm. And is there overlap between social health and mental health? Yeah, of course. Can effective mental health intervention improve social health? Absolutely. But the same overlap exists between physical health and mental health. Yet we don't, we don't just resource one of those two and rely on the improvements of one to solve the other. We resource both physical and mental health. And, I think we need to start resourcing social health more. And that becomes the opportunity. And there's a tremendous role for tech to play in doing so. And, I think in terms of what that role is, as usual with tech, when it's applied properly, it creates solutions that are more accessible and scalable. So that's where the opportunity is.
So it's around helping people build high quality relationships. Because it seems like there's, you and I have, like, you've invested and even built a lot of startups to scale, right? Whether it was like Snap to Musical.ly to TikTok and more. And it's like, I feel like those don't necessarily, it's kind of like the Twitch problem that you mentioned. You're like surrounded by a lot of people, but like, it doesn't mean that you're sometimes it could like exacerbate loneliness more so than help it.
Yeah. So like social health solutions should really kind of always be designed around actual social interaction with support, of course, along the way. But at least that's our approach to it. And so the challenge becomes, well, how to create technology that can help us develop and improve social confidence, social ability, and motivate us to put that in practice in real life, whether it's having hard conversations at work or whether it's, actually participating in the Twitch stream that you've been, a voyeur of for a while. And so we have this big vision around building a social health platform that can address a lot of needs here, but we need to pick a starting point. And for us, the starting point we've picked is social anxiety. And the reason for that is, again, the market size. So over 40 million US adults and 1 in 3 adolescents experience moderate to severe social anxiety. And social anxiety is super common. In fact, all of us have it. Just like anxiety, period, you need some of it to survive. Like social anxiety does help you avoid bad situations too. But when you experience it in a continued way and in a way that's actually gets in the way of experiencing social situations in their fullest, that's when it becomes a problem. So our solution rests on the principles of exposure therapy, which is the strongest evidence-based solution to treat social anxiety. And we've been working for the last year plus on figuring out how to deliver that through a mobile application that can scale, be personalized, be affordable, but also be highly effective. So in a nutshell, to oversimplify it, we essentially identify where social anxiety shows up for you. Since it's very unique to the individual, we put you on a plan to do the things you most frequently avoid or experience negatively, step by step, starting with small interactions leading up to the harder ones. And it's pretty neat. And we're kind of seeing some awesome results so far in initial beta rollout, which started in October. And I know we don't have time to get into the product here, but happy to share more details with anyone listening if they want to message me.
So I guess the question is, and you mentioned that loneliness is not something that's new, right? And so why is it happening now? And like, why do you think this is the right time for Loop?
Yeah, so there's a few things that stand out to me on like why it's a problem that's getting worse. The first one is we're kind of 15 years or so into this massive social experiment we've been running by making a handful of content feeds our primary conduit for interaction and information, which I kind of liken this period to the when Facebook rolled out the news feed. That really shifted Facebook from a place where you're connecting with family and friends to a place where you're consuming content. And while there's definitely positive applications of social media, or probably better term today, consumption media, it's increasingly sort of robbing us of true social experience and exposure. And the less social experience and exposure we have, especially as you're coming of age, so if you're a teenager, as you grow into being an adult, if you have limited social experience and social exposure because of time spent in these feeds, well, you're going to be less able and less confident to deal with social situations, especially adverse ones. So it also creates a lot of distrust and angst. And I believe that it's dividing us much more than it brings us together. Don't want to go in the rabbit hole of social media and how to fix it, but it's definitely a contributing factor. The other one is the pandemic. Of course, we just talked about that, but that really disrupted our social lives. It really forever changed how we interact, how we work. And it's had a really, really big impact on the workplace. Like how many teams now are remote or hybrid? And in a remote or hybrid situation, there are a lot of advantages to it. There's a lot more freedom. People can be way more productive, but it's much harder to build connections with each other, right? In a remote and hybrid setting. And so you're seeing social anxiety, but really social health, more broadly speaking, become a bigger and bigger problem at work, in part due to us being physically disconnected from each other.
Yeah, I think like the physical connection is so important. Like even you and I, we spent a lot of time spent together, right? Like side by side in an office or in a room, and really getting to know each other than like a very transactional screen, which I think builds such a strong, like when we had dinner in New York, it's like, right? Like there's so many things you can do in person that you just can't do it with just a screen.
Absolutely. And the third one that stands out to me is, we're sort of caught up in this flywheel of comparing ourselves to others. And yes, social media, a big role in this as well. But it's not just a social media problem. Let's take work again. The best jobs at the best companies are highly competitive. And if you don't cut it, you're going to get cut pretty quickly. And so we're sort of constantly comparing ourselves, even at work, not just to our coworkers, but others in the industry.
Right.
And that in turn lowers our self-esteem, it lowers our self-confidence, and then that makes us socially unhealthy, and that contributes to feeling alone and feeling lonely.
Okay, there's a lot of things to solve. And so I guess how will the world be changed by Loop in the next, 5 to 10 years? Like what can Loop do for us?
Well, I guess if we're successful at delivering on our mission, we're going to contribute to making this world socially healthier. We can enable more people to build high quality relationships and succeed in social situations. It's a big vision, and we're at the very beginning stages of it. But we're seeing people already using Loop, despite just being a couple months into our beta rollout and having positive effects. Our users are telling us things like they've been able to go on first dates or speak up in work meetings for the first time in years. In some cases, first time ever, because of the habits they're building using Loop. And so we're seeing real tangible behavior change. And this is how, for me, any behavioral health intervention should be measured, not on time spent or engagement, but on actual behavior change. So if we can take that impact we're seeing and scale it to the millions that need it, we'll deliver on our mission. So when we think about Loop long-term, we want to be the social health provider for employers, for universities, for community health centers, general practitioners, and individuals that want to engage in our services directly outside of those channels.
I really hope this mission, like, and vision that you have, that is so visionary, but also so important for our society, like, can kickstart pretty soon. And you're already seeing it work out in the beta test, so it's so promising. Um, the last question for you is, how are you reimagining yourself as a leader?
A lot of different ways. I think like for me, as with a lot of other people, the last few years have been tough for external factors. But a lot of it is due to my own struggles with my social health. So like I have social triggers like anybody else. And for too long in my life and in my career, when those triggers, those alarm bells would go off, they would overwhelm me. I didn't have the skills or mindset to kind of manage that better in the moment. I would get caught up in these negative spirals when I felt someone was upset with me or dissatisfied with my work, and would do things that actually compound the problem, not help it. Of course, in the moment, I don't think that. And that in turn makes me more socially anxious and more easily triggered. And again, it's this vicious cycle. So, I working at Loop in a way has helped me a lot. I have an unfair advantage in that I have around the clock access to our clinical team, not in terms of like treating me, but just absorbing their knowledge and in our program overall. And that's helped me in a really meaningful way. So, that's, what I want to get this, that's why I want to get this out of the world, right? Because I'm so bullish on, the impact it can have on people. And so that's a big part of it in terms of me evolving as a leader. Another part for me is recognizing and understanding as a leader, it's not my job to be right. It's not my job to be good at everything or even involved with everything. The number one job for me is to assemble the right team, set them up to succeed. And honestly, everything else is a distant second to that. I realize now, and it took me a long time to realize this, but I can be wrong about a lot of things. But if I have the right team that are empowered, that are set up to succeed, well, then as a group, we're going to collectively make the right decisions and continue to grow. So those, are some of the ways that, I have evolved and will continue to evolve. I'm a work in progress always until I'm, in the grave. And that's life.
I love that about you. And I love that you always like share it too, whenever we talk. Right. And so I appreciate that. I think there are two things that were my favorite pieces of our talk today. One, I think it's the takeaway that, like, if physical health is a measure of the health of our body, and that mental health is a measure of like the health of our mind and our emotional state, social health is the measure of the health of our relationships. And I think prior to Loop, like, I actually never really spent time thinking about that. And I think the second takeaway is that, like, we all face this in all aspects of our life, right? Like you said, at work or within our friend circles or wherever it is, even at home. And it's really important that when you go to work and you do show up, and sometimes there is some type of conflict that happens between you or your colleague or everybody in the room, you don't know what the situation of everyone's social health or emotional state, right? Like, you only see some things and you're like, oh, they're not responding quick enough, or like they're not on the same page as me, and you jump to different conclusions. But if we all take a step back and like focus on like our relationships and the quality of our relationship with our friends, with our colleagues, like, it will just make everyone happier and hopefully better. And so I always think about Loop and how that applies to, what you guys are doing applies to all of us.
Yeah, it definitely does. I mean, it's a spectrum like everything else, right? There's some people that are socially healthier than others. And kudos to those people, like, awesome. We need them, we need them in our world for sure. But a lot of us struggle in this area and sometimes don't think of it in these terms. And for me, I look back at my life and I have struggled so much in my social health. But up until working on Loop, I never thought about it that way. I just thought I was like an introvert who doesn't like people, right? That's not the case. That's what I was told. because again, those misconceptions around social health and loneliness. So I do think, this is something that hopefully people can keep talking about, keep working on. And I hope Loop is not the only company. I don't want us to have a monopoly on social health. I don't think any company in the mental health space should be aiming for building a monopoly. I think there's just so many people, there's so many modalities of care that are needed. And the more entrepreneurs, the more venture capital that we can get pointed at this social health problem, the better.
Yeah. I feel like I can talk to you all day about this, but I think we'll probably save it for part 2. And yeah, I want to check in with you later on this year and see how things are, and maybe even talk to like employer partners or universities or even like users who've gone through Loop's programs and see, what the outcome has been. So like in all, like, thank you so much, James, for
thank you.
You as a human being, you as a CEO of founding Loop, and just also letting GGV be a part of your journey.
Yeah, and big thanks to GGV. You and Hans especially been in my corner since I've known you both. And I know it's been a journey for us to, figure out how to crack the code on solving this problem. And we kind of finally figured it out. But wouldn't be here without you, without Hans, without the team at GGV. So yeah, like the thanks and the kudos goes both ways.
Thank you. Well, stay tuned, everyone, for our next episode. Happy New Year.
Right.